Hello, welcome back, or maybe you're here for the first time. This is our lab review. I want to give you a comprehensive review of what this will feel like when you meet with me. So labs are probably one of the most important things that we get prior to setting up a plan for you to get your hormones balanced or to get optimized with your health on our Feel Good program. I would like to point out before we go any further, these are actually my labs, so there's no HIPAA violation here. White blood cells fight off infection. Red blood cells carry oxygen to tissues. So you can see my levels were normal. Hemoglobin and hematocrit, the next two things down that list, show us how thick or how thin our blood is. If our blood is too thick, we can have a tendency for blood clots. If it's too thin, we could be anemic. So those are important factors to look at. That midsection where it says MCV clear down to platelet count, those are basically the size and shape of our blood cells. We won't go into too much detail there, except for platelets. That's very important. Platelets are what make us clot. So we want to make sure we're in a normal clotting range. So for example, if you're in a motor vehicle accident, we know that yes, you're going to clot if you're injured or if you get a bad cut. And that's kind of the importance of the first part of these labs with the complete blood count. All right, now it gets a little more fun. We're going to talk about our general chemistries of our blood. So the first thing we look at is our glucose level or blood sugars, which is it's a very important marker for perhaps diabetes. We'll look at something else a little more important in a minute called the hemoglobin A1C. We'll get to there in a second. So BUN and creatine show us our kidney function, okay? Those are important numbers to know as well. The other one is down here called the GFR. That's the filtration rate of our kidneys. And you can see mine, thankfully, are all within normal ranges, but if those things are off, we need to know it. And I've actually found a lot of patients that haven't known this, but they've had some kidney issues. As we look down through sodium, potassium, chloride, calcium, carbon, those are all electrolytes. So electrolytes help keep our body balanced. Electrolytes are very important. One that we'll pick on, for example, is potassium. So if we have a low potassium, it can lead to heart issues, including irregular heart rates or irregular heart rhythms. So we look at those and make sure everything is going fine there, or correct them if we need to. As we get towards the bottom, we're starting to focus more on liver function tests, and especially the ALT and AST. Those are important liver enzymes that we look at to make sure that the liver is doing well. For example, someone that might drink a little too much, those could be elevated. Or it could be genetic, but it's good to find these things so we can help correct them. The next important thing we're going to look at is your diabetes evaluation with a hemoglobin A1C. A hemoglobin A1C is a 3-month average or measurement of your blood sugars. So with that level, you want to be under 5.7. And you can see I was actually at 5.1, which shows that I'm not diabetic or pre-diabetic. I've seen a lot of people that haven't known that they're pre-diabetic or diabetic, and we've been able to change that. So that's a very important thing we look at. Prior to myself starting this program, I was actually at 5.8. So I was in a pre-diabetic range. I didn't even know it. With work over the past year, I've gotten out of that, clear down to 5.1. So that's an important thing to know. The next thing we look at is vitamin B12, which looks at iron and anemia, or it's an anemia evaluation. So you can see mine is very high. And the reason for that is because I've been supplementing with vitamin B12 injections, which really help with energy and sustain metabolism. So it's okay to be high. It's not bad to be high. Your body will use what it can, and then it will get rid of the rest. The next part is heart. So the coronary risk. We look at triglycerides, which is the fatty substance we carry within our blood, total cholesterol, HDL cholesterol, and LDL cholesterol. Now, HDL cholesterol is the good cholesterol. That's the cholesterol we want to be high in. And as you can see, that's one number that I'm a little low in myself. So what causes that? Oftentimes it can be genetic. Sometimes it can be diet and exercise. With me, it's always been genetic. I've always been a little low. Now the LDL cholesterol, that's the bad cholesterol. So that is the cholesterol we don't want to be over 100, and I'm actually at 124. Again, unfortunately, a part of that is my genetics. I work hard to keep it down, but sometimes, Mother Nature takes over a little bit. The most important number, however, is this one. This number is a total cholesterol divided by HDL cholesterol, and that shows us our risk for heart disease. And I am under the barrier of 5.0 at 4.7, so that's good. That's something I'm continually working on, but we'll look at that and make sure you're in a good spot. One of the most important things we're going to look at is vitamin D. Vitamin D is vital. It's one of the things that over the past 3 to 5 years, there's been a lot of research showing the importance of it. Vitamin D is good for your heart. It's good for immunity. It's also really good for sustained mood. Vitamin D, if I could give you one medicine, it would probably be that. It is outstanding for your skin as well, but you can see I'm a little high, and that's because I've supplemented. Being a little bit high is not bad. We don't want you over 150, but vitamin D levels, getting those balanced makes a huge difference in a lot of people's lives. We also take a very good look at the thyroid. So there's three thyroid markers: free T3, free T4. Those are actually the active thyroid that works in our body. So we look at those numbers and make sure they're balanced. Also the TSH, that's the thyroid stimulating hormone. That's the signal that the brain is giving to the body to make thyroid. So we make sure those are on and make adjustments as needed as well. For males, we get what's called a PSA, or prostate specific antigen marker. So that is one we look for prostate cancer, not really for the cancer, but markers that might lead to additional testing for that. So that's very important for males. Obviously, we don't get that test on females. Now, the next thing we're going to look at is endocrine evaluation. So now we're looking at our male and female hormones. So men need testosterone and estrogen, as do women. The important thing is having that balance. And as we age, our levels decline over time. In fact, in our late 20s, our levels start to decrease. So by the time we're hitting the 30s and 40s, for most people, those levels have markedly decreased. And of course, when you're my age into the 50s, they're way down. So we look at these. Now, my levels have been corrected, but I'll just give you an example here. So the FSH that you see there, that is a stimulating hormone, and you can see mine is very low. Now the reason for that is because I'm on hormone replacement therapy, okay? If I were not, it would probably be in a normal range. Now I'm gonna come down to estradiol, okay? Estradiol is basically estrogen. Now men need it as women do. So as we supplement with testosterone replacement therapy, the estradiol or estrogen also comes up, or it basically rises in proportion to the testosterone that's being replaced. So you can see mine is at 60. It's a little above normal, but I'm very comfortable with that. I've had no side effects. So it should come up as we replace testosterone. Now, if we look here at my total testosterone, when I started, I was in the 200s. So as you can imagine, I was not feeling very good. Now look at this range. It's 280 to 1100. And I'm going to tell you now, when a man is in the lower end of normal, from what a laboratory test shows, he's not going to feel very good, and I didn't. You can see now I'm at about over 1200, and I feel great. Everything is stabilized, my energy is good, my mood's good. I feel better in the gym. I'm retaining lean muscle mass. I'm getting rid of body fat. So anyway, that's very important for men and women. Women do need some testosterone. Certainly not nearly as high, in fact, just a fraction, but that is so important. This number down here, free testosterone, is also something we look at to make sure things are balanced well. All right, now we're going to move on to cortisol. So cortisol is our stress hormone. It's the hormone that produces sometimes inflammation, but I will tell you, although my level looks normal, I definitely have a fair amount of stress, but I've felt so much better since I started this program. My numbers have come down significantly. So we treat everyone to help balance their cortisol levels with a medicine called DHEA. And I'll explain more to you about that later as we meet together. But it's a great hormone that's made in the adrenal glands. It really helps optimize our cortisol as well as optimize the rest of our hormones. The final thing we look at is the CRP, or inflammatory marker. Now, this marker may be high if someone has an autoimmune disease or if they have acute infection. In my previous world, where I worked in orthopedics for about 20 plus years, we would check for that if we suspected any joint infection or infection prior to surgery. So that's where we wrap up. Now, as we sit together, we're going to go through this so you can really understand what these labs mean. It's very important not just to see the numbers, but to really understand why we have the numbers we do and the ultimate goal of getting them to the place that they are healthy. Now, oftentimes numbers are numbers. So as long as they're in a healthy range, my focus will be just to get you feeling your optimal best.